Greetings again. This is Dr. Bill Wyatt in Glen Rose, Texas, and I'm with the American Orthodontics Society, and we're going to talk about another kind of restorative case, but actually we're doing that by uprighting some molars back in here. She's missing her, I think it's her second molars that are missing, and we're carry the case through and we bring the wisdom teeth up and slide them into that spot, and that's a restorative method also. So let's get going. I'll try to cover these as fast as I can. I know people get tired of watching. This is a young lady, and the facial structure is all right. There's no big problem with that area. And here we have a picture again a little later on. And now, at this point, we have several things wrong here. See, we've got cuspid teeth coming in here. Now, I don't have pictures of how we corrected that, but we opened this space up since we were missing teeth back here in the back of the mouth. And so we opened this gap and we saved these teeth in this area. And we moved this back and we tilted these teeth back and worked it together. So you can watch how we did this. Now this takes a good long while to do. You start out, you got deciduous teeth here, and we'll remove those deciduous teeth, and that helps us get this teeth down. Now we've got a crowded problem, but we will have this space from here to here, and we'll get these three teeth in that area, and that pushes them back, and now we have to upright these to get them in. So she's age 12 here. This is 1983, and let's see what happens. Now I jump way over in this, and I don't show you how we move those other teeth or expanded that and brought the teeth in, but we did that. And we've got it lined up, and now she's age 14, and we've got these wisdom teeth coming in back here, and then they're not very well developed, so we take time. We have to get now and get these teeth up in this area back here. So this is not because of slow orthodontics, but you're waiting for teeth to erupt in the mouth to do this. So we follow them along, and this is 19, she's age 14 now and 7 months, and the teeth have come forward. But we're going to have to upright some teeth back here. And I have never seen a tooth that we couldn't upright. Even if it was laying flat down, we could pick that thing up like this. I guess if it was headed down that way, I've never run into the one that way. If you could get to it though, and you'd have to uncover it and bond something on it, you could straighten it up too. So that can happen. All right, this is 1986. So we're waiting on these teeth to come in. And here we are in 1987. The wisdom tooth, we've got one over here, we straightened it out and it's coming up okay. Over here we had to put a rig in with that wire going down, bring it up and hook it over on this side. And we did that. And you can see right now that tooth will go back into place. Now this is 1988. We got this one in nice, real good. So we're waiting on the eruption of the wisdom teeth to do this. And we're going to upright that wisdom tooth. And we didn't need the braces on. You could start back. We just bonded a wire on these teeth and put a tube on this and put this spring. This wire was going down here. We raise it up and hook it over like that. Now there it is. This wire is picked up and hooked over here, and it'll pick this tooth up and bring it back. And now here we're in 1988. So it took some time to do that, but this young lady has a nice set of teeth, and we're restoring this by doing orthodontics back here in the back of the mouth. We can call that restorative dentistry with orthodontics, and that's the way it ended up. So you take time to do it, but when you get through, you've got your natural teeth, and the bone structure will follow those teeth, and it'll stay that way, and you can spend your life with your regular teeth if you take care of them properly. And we got a little bit of resorption up here on some of these teeth, but not much. And I've never lost a tooth from root resorption over all the teeth we've worked on through these years. So here, that's the tooth again, and this is the bone structure around it. You see how it's developed there. And there we are at 90. It's still sitting good, and she wears a retainer, and then you get where the pressure is equal in there. Everything, you can leave your retainer off, or you might sleep in it at night some. And we had a little bit of root resorption in this, but the teeth are looking good. Now here is uprighting this wisdom tooth. This is the second molar is gone, and we just bonded a wire on here. We were through the orthodontics, and this comes along, so we didn't stay in orthodontics all that long. We come back and come on top of it and just bond a wire on that, put a bracket on this tooth, and put the spring right in here, and be going down. We bring it up and hook it on that wire, brings that tooth in. So we fix it up. Now you see that. That's the way we made this, where we activated some and tied it and then put it in, and it wouldn't be poking them in the gingival tissue. And then you cut this wire where this thing pops back out like that. And this is just a bonded, we're uprighting a tooth years after we got through with the major part of the orthodontics. So what I want to bring out here is, if you have an impacted wisdom tooth like this, and you can just bond a wire on there, and you can upright that tooth, and the wisdom tooth is in the best chewing area in the mouth. And you can save the wisdom teeth, and it doesn't take a great deal of effort to do that, and you can upright that wisdom tooth, and it'll serve your whole lifetime. So thank you again. Now I'm going to close this out. You see this on the other side. And now that's the tooth, and the springs are bringing that up. And we bring it, keep moving it here. And now we've got the tooth up back here. And you can learn how to do this. If you don't have anybody to show you around here, you can come to Dallas, the Dallas International Airport, or Dallas Fort Worth, and you're just about 5 minutes from the office in Grapevine, where we have our headquarters. Thank you. Now we'll close out, and hope you'll join our deal, and I'll see you again later. I hope you'll watch our channel.